I am Dr. William Schneider. I'm a holistic physician. Welcome to the Pain and Wellness Center New Patient Orientation. I have a degree in nutrition, chiropractic, and acupuncture. I am also trained in a whole array of other approaches to include applied kinesiology, functional medicine, specialized acupuncture for allergy elimination, specialized acupuncture for arthritis, laser therapy, decompression therapy, cranial therapy, and actually a lot more. Can I be totally honest with you? Early in my career, I was frustrated. You know, I have all this training, however, I wasn't getting the results I knew I could. As a result, I spent a long time in analysis and contemplation. What I discovered changed my life and the life of my patients. Don't do this. Before we go any further, I need to warn you about two things that will hold you back as you go through this orientation. Either of these two things could stop you dead in your tracks. The two non-starters, either of which could stop you in your tracks. The first is the thought of, I knew that. Oftentimes we blind ourselves and assume we already know something, or we've already seen it before. Don't do that. But I'm sure you think you've seen people using my approach. But it's one thing to be on the outside observing, trying to reverse engineer a process, and it's another thing to get a look behind the scenes. I'm going to show you how and why it actually works. The second thing that will hold you back is the thought of, I disagree. And I know it's easy to go there. And I'll admit that some of the things I'm going to teach you are going to seem counterintuitive and strange. But I think they are all going to start to make sense to you pretty quickly. Again, this comes from experience. I don't want to scare you off with some big claims, but I've been using this program for over 20 years. And I've seen some great results with virtually everyone who follows it. You are only as strong as your foundation. The problem I discovered, what allowed me to transition my approach, is a realization that the foundation upon which healthcare education is based upon is flawed. Here is the issue. You go to a doctor with a symptom or a complaint. He or she listens to you, maybe examines you, possibly orders some tests, eventually giving you a diagnosis, then recommends a treatment or a medication. Well, maybe you're interested in a non-medical approach. So one of the most common things people do, they'll go to a chiropractor. Well, he or she goes through a very similar exam, diagnosis, and treatment approach. You probably end up getting a chiropractic adjustment for your symptom. Well, maybe you decide to go to an acupuncturist. He or she listens to your symptoms and then provides you with acupuncture for those symptoms, or your illness or your disease. Well, maybe you decide to go to a nutritionist, or you look up your symptoms in a nutrition book, or maybe you go to a health food store and ask the person behind the counter. Eventually you end up with a vitamin, an herb, or a supplement for your symptoms. Astonishing, isn't it? There are very many similarities. That has become the foundation upon which the education is established is very similar. Doctors are taught to listen to your symptoms, provide a name for it, then suggest a treatment for that name. That is the problem in and of itself. You are not your symptoms. You are not an illness or disease you've been diagnosed with. And unfortunately, education is so deeply ingrained within our healthcare practitioners that they do not even realize a flaw in the system. Even doctors that provide alternative therapies who may claim they get to the cause are really only treating the symptoms using an alternative approach to medicine. You will recognize this, for the practitioner continues to discuss your symptoms. Well, if you are getting to the cause and correcting it, the symptom should not be the means of analysis. And most, if not all, of these practitioners are severely limited in the way they diagnose and treat, based upon the guidelines and regulations enforced by insurance companies. You have experienced this and have heard your doctor comment regarding the options for treatment based on an insurance company's guidelines. Really? An insurance company, a business that operates solely on the basis of profit, is the one to decide how your doctor will care for you. The only way you can be comfortable with this system is if your only interest is to use your health insurance regardless of the outcome. You have to be content knowing that you will not be receiving the best care for you. Your treatment will not be based upon the recommendations of your doctor, but on what the insurance company okays. You have seen cases on the news about insurance companies denying vital care based solely on finances. There is a better way. That is why I created a new foundation. One that is not based on your symptoms. One that is not influenced by insurance companies. One that allows me to analyze and discover your unique underlying physical, physiological, and vital energy imbalances. Once this has been accomplished, I can focus specifically on correcting what is going wrong with your body, improving function, which results in enhanced health and resolution of your symptoms. So, what's the foundation of your illness and disease? The easiest way to understand this is to consider the straw that broke the camel's back. So here comes a camel. You throw a straw in the camel and it falls to the ground. The camel has a symptom. The camel is unable to stand up. So the obvious treatment is to remove the straw, right? Well, the camel still cannot get up. What is another treatment you can do for this symptom? Well, you get a crane, lift the camel up. Sort of like a person using a walker or a scooter, because that person can't stand up. The next step. Well, you can analyze the straw. You can study the straw. You can send the camel to a straw specialist. Try to figure out how that straw affected the camel. Sort of like sending patients to multiple different specialists to analyze their illness, disease, or symptoms. Well, you know the answer to the camel scenario. The camel did not fall to the ground as a result of the straw. The camel fell to the ground as a result of everything piled up on its back along the journey. And you know, the things the camel carried the longest, the things that were placed on the camel first or early on, had the most impact. This is synonymous to the things that happened early in your life, things that have been piled up on your back. When I explain this to patients and begin the process of analysis, the most common response I hear is, I used to have that. Nah, I grew out of that. No, actually, I don't suffer from that any longer. You have to understand, that is equivalent to saying all that stuff piled up on the camel really wasn't the cause of it falling down. The straw is the problem. Ridiculous, isn't it? It is obvious. The cause of the camel collapsing was all the stuff piled upon its back. And the things that it carried the longest had the greatest impact. That journey is equivalent to your life. which is your journey. And just as every camel traveled its own journey and had unique items piled up on its back, every person has their own journey and has their own unique things piled up. So one of the things we will do is have you fill out a questionnaire and write out your own personal journey or your health history. Holistic healthcare, it's not the tooth fairy. You may come across people, especially medically oriented people, who make comment that they don't believe in holistic healthcare. Well, the approaches I utilize do not require belief. They are based upon science, and more research is becoming available every day proving the type of healthcare I provide to be more effective than most traditional therapies. And during this class, I'm going to teach you how these approaches work. In order to understand the type of care I provide, you need to be aware of how the body functions. And first and foremost, you need to know the one thing. There is an innate supply of vital electrical energy which gives your body life. In acupuncture, we call it the qi. This energy is managed and distributed within and around your nervous system in channels we call meridians. So one of the techniques I use in the office is a means of analyzing the intensity and the flow of the vital energy. This is called an electromeridian analysis. Every person has a unique pattern and distribution of this innate supply of energy or qi. If there is any interference along these pathways, then your body will not function properly. Discovering this will allow me to thoroughly analyze and provide specialized acupuncture for your condition. I can enhance and balance that vital energy. You may wonder, are there any other ways that your body coordinates the distribution of this energy to our tissues or cells? Your brain manages this vital electrical energy like a supercomputer and distributes it in the form of nerve impulses. These impulses are sent to all of your body tissues and cells, and electrical impulses are simultaneously sent back to the brain. All of these impulses are carried primarily through nerves. However, as you just learned, the meridians also play a role in this distribution. Life flows from your brain down the spinal cord, through your spinal nerves to every cell in your body. If there is any interference along this pathway, then your body will not function properly. Unimpeded transmission is vital for the body to stay healthy. Innate intelligence recognizes from an early on how important this system is and how important this communication is, so it built a protective armor to house it. This is called your skull and spine. There are 3 parts to your spine. There is a cervical, thoracic, and lumbar. Your spine is what protects your nervous system. There are bones that make up your spine called vertebrae. They are separated by shock absorbers called discs. The vertebra and the disc create the spinal canal that contains your spinal cord. These discs also separate the bones, creating an opening for 27 pairs of nerves to exit. These nerves control every function of your body, from muscle function to digestion, breathing, beating of your heart, and every other function. Have you ever heard of a subluxation? The first part of the word is sub, which means less than. Lux means life, and ation means condition of. Strictly speaking, so it is a condition of your body in which the brain impulses are interfered with. And as a result, that part of your body reduces its function. And eventually that can lead to symptoms, illness and disease. So you ask, how does that happen? Well, it's a result of falls, traumas, sitting, lifting, bending, poor diet, nutritional deficiency, stress, and more. Just about any physical, chemical, and emotional stress you have been exposed to, even the birthing process will cause, not may cause, will cause subluxations, a less life condition. This condition results from structural imbalances within the spine, the alignment of vertebra, degenerative discs, herniated discs, adhesions and scar tissue within the muscles, ligaments, and even the nerves cause subluxations, a less life condition. Can this really be true? The organs, glands, muscles, all the tissues supplied by those nerves, if there's a subluxation, they'll have less life. There are nerves that come out of the neck, your cervical spine, which may affect things such as high blood pressure, headaches, and more. There are nerves that are in your thoracic spine, your middle back, that if those are affected with a subluxation may cause lung problems, heart problems, stomach and digestive problems, and even more. You may have a subluxation of your low back, your lumbar spine, that it can affect your bowel, your bladder, the uterus, prostate, and more. So one of the major things I will be doing is detecting subluxation. And I will begin that process on your first visit in the form of a physical exam. But hang on a minute. I know you have symptoms, and yes, I want to get you out of your symptoms. However, the first step in the process is to discover what unique underlying imbalances occur within your body causing your symptoms. So when you come into the office, impress me and ask me to find your underlying imbalances. Tell me you're not interested in a treatment for your symptoms. Ask me how to help your body heal. Insist on not speaking about your symptoms, so as not to impede the process of correcting the underlying problems. Tell me you want the underlying problems corrected. A lot of patients believe the treatments I perform are the most important thing I do at the clinic. Well, they are not. This orientation class is the most important part of your care, the most important part, which is why we have every patient view this before we start. The first step is to understand how I approach illness and disease and symptoms. And as you just learned, it is not about your symptoms, is it? If you want to focus on your symptoms, you will continue to chase them for the rest of your life. And I have had patients do just that. I have had patients enter the clinic, listen to what I found, and opt to go another route. It is common to hear a patient tell me that they had spent 15 years looking for a quick fix, only to recall a conversation I had with them about identifying and correcting underlying causes, and as a result, their symptoms would go away. Then they would no longer have to chase that symptom around, and they'd no longer have to chase that quick fix. A lot can be accomplished in 15 years with the right approach. Don't make that mistake. You know, it's like getting in your car and driving without a map or directions to your destination. So instead of stopping and asking for directions, you drive faster and faster, hoping you will eventually get to where you want to be. Sound familiar? This is how most individuals manage their health care. You can discover the underlying cause. You can receive healing, repairing, and restoring approaches. Your symptoms can resolve as a result of getting to the underlying cause. The goal of this approach is to show you the critical things you need to do, and in doing it in a way that gives you the lifestyle that you want. You know, I am in this calling to make the biggest positive impact I can make. So I see everyone from newborns to seniors. Yeah, you heard that right, newborns. In reality, these patients need this type of care the most. The birthing process is physically and chemically stressful on an infant. When a child is born, the head comes out. The head then uses a leverage to rotate the shoulders out. It is very common for a child to be born with one of those subluxations we recently talked about. There was a study done in 1984 by a Dr. Tobin and a Dr. Gutman, where they studied babies that died of sudden infant death. What they found was during the birthing process, the head comes out first, and in order to get the shoulders out, the neck is rotated. When the neck is rotated, there's a bone up here in your neck, the second bone that goes out of its normal position. When that happens, it occludes one of the vertebral arteries. They are major arteries that blood flow up into the brain. Mothers used to be taught to put their babies in bed on their stomachs. And in order for the baby to breathe, it would have to turn its head. When that happened, another subluxation developed affecting the other vertebral artery. Now both arteries are occluded. And what they concluded is that the babies died of hypoxia, or lack of blood flow to the head. This is the main reason for sudden infant death. So after that study, mothers were advised to put their babies to sleep on their back. Now what makes more sense? Trying to keep your baby on its back, altering how your baby sleeps, or correcting the underlying cause? Would it be healthier to correct the subluxation? I think so. So at birth, your child needs to be checked to identify if there is a subluxation. If there is, it can be easily corrected with a simple, gentle adjustment. The amount of pressure used is just the pressure you would apply if you put your finger over your eyelid. Just a little bit of pressure. That's all I use. To put the bone back in position and take the pressure off that nerve and the artery. Why doesn't every parent demand that their child be checked? At least half of the children I have checked are out of alignment. So why is it that children aren't being checked? Well, because every new parent thought like you did. You know, the way you were thinking before this orientation. They thought all chiropractic and holistic health care was just to treat pain. And I don't do that. Their baby comes out and they say, "Oh, my baby, it looks fine. My baby doesn't hurt. Don't touch my baby." When in fact, the holistic and chiropractic approach I use is not to treat the pain. It is to detect and correct physical imbalances like subluxations, enhance the vital energy in the body through acupuncture, and improve the physiology through diet and nutrition to allow the body to function properly again. So get this out of your mind. The care I provide is to treat pain or symptoms. It is focusing on eliminating interference within the vital energy, identifying correcting subluxations, and improving your physiology to allow your body to function properly, period. That's it. An easy way to understand how your nervous system works is to associate the way a dimmer switch affects a light bulb. The electricity itself represents that vital energy that gives your body life. The electrical box in your house represents your brain. The dimmer switch on the wall represents your vertebra. And the wire going to the light bulb is the nerve. And the light is, in this example, we're going to talk about the stomach. If you have ample amount of electricity coming from the power plant, and your vertebrae are properly aligned, optimal levels of electricity will get to the bulb, or in our scenario, your stomach. The bulb will be bright. Your stomach will function normally. The gastric nerve controls the stomach and exists at the level of the thoracic 6 vertebra in your middle back. So what happens if we decrease the vital energy, or a vertebra is slightly out of position and just puts a little bit of pressure on the nerve? The impulse is only reduced by 10%. If you look at the light bulb, it's not going to look much different, because you still have 90% health or 90% electricity. You will only be 10% diseased, not diseased, diseased, not in a state of ease. You feel 90% healthy. You feel great. So let's decrease the impulse a little bit more. Let's put 5 millimeters of pressure on that nerve. Again, you feel great. Now let's put a little more, over 5 millimeters of pressure on that nerve, so that causes you to go past the pain threshold. You begin to feel pressure on the nerve. You may even have occasional back discomfort. And if you look at the light bulb, it's sort of noticeably dimmer. You begin to start belching. And you begin to start making excuses. Oh, my back hurts. Oh, it's nothing, it'll go away. Belching. It must have been that soda I had for lunch. It couldn't possibly be my gastric nerve. It couldn't possibly be the decreased vital energy or a nerve at thoracic 6 being pinched. Let's decrease the vital energy, and let's put even more pressure on that nerve at T6. Now you get bloating. It must be something I had for lunch, maybe too much fat or salt. Can't possibly be that pinched nerve. 50%. Look at what happens to the intensity of the light. Now you have nausea. Oh, we were taught what to do for this on television, right? Belching, bloating, indigestion. Belching, bloating, indigestion. You must need some Pepto-Bismol. You need to hide those symptoms. You don't want to take care of the cause, right? What happens when the impulse is decreased by 60%? Now you start getting heartburn. Heartburn is heartburn. Ask any cardiologist. He or she will tell you that when the digestive system shuts down, the next system to develop problems is the cardiovascular system. When you get to a 70% decrease of the neurological impulse, you'll probably get bleeding, ulcers. 80%, now you start getting dizzy. The light will be barely noticeable in the room at that point. The tissue that the nerve supply is dying. People come into the office all the time and they are dim light bulbs. They waited too long. The problem is developed into advanced disease. If you have more than 12 millimeters of pressure, there is an 80% decrease in nerve function, and if it exists for more than 6 months, it creates a condition of which you might have permanent nerve damage. And anywhere that nerve goes, what will happen to the cells at the other end of the nerve? 90% equals cellular death. This is not a hard concept. This is a good analogy of how your body works. So don't look at the care I provide anymore as like a construction worker that cracks and pops your bones back into position. I'm a little bit different. I'm a holistic physician. The holistic care I provide is more focused on taking you from being a dim light bulb identifying the things decreasing the vital energy, causing subluxations, and altering your physiology and improving upon them so you can once again be a bright light bulb. Save money and stay healthy. Is it even possible? It is sort of like taking care of your car. Change the oil, rotate the tires, and some other things, right? And you just do it. However, when it comes to your health, well, not so good, right? And people ask me about what I talk about. They say, well, is there research that proves what you do? Is there research? And if there is, why haven't you been made aware of it? And why hasn't it changed the healthcare system? Good questions. I'm very proud of you for asking. Well, there's a ton of research. And the research shows that holistic care can greatly reduce your expenses and at the same time keep you remarkably healthy. However, before we get into that, I want to ask you a question. Which system of healthcare seems logical? A healthcare system like we currently have, where you go to a doctor when you have a symptom, illness, or disease, and your doctor gives you a medication, suggests surgery, a system that focuses on covering up your symptoms or altering your body, cutting things out and putting foreign objects into your body, or a healthcare system of which you go to a doctor that helps you stay healthy. A doctor that analyzes your health history to identify potential problems, then develops a proactive program of diet and nutrition to reduce or prevent things from developing. A doctor who throughout your life educates you and counsels you on diet and nutrition. A doctor who identifies and corrects physical imbalances rather than giving you medication to suppress your symptoms. A doctor who helps your body maintain its vital energy, correct subluxations, so your brain can effectively communicate and keep your organs, glands, and tissues healthy. Just imagine a healthcare system of which you go to a doctor when you feel good, and his or her focus is on keeping you healthy and feeling good. A doctor who wants you to come in the office to stay healthy. Think about it. What would your traditional medical family doctor say if you entered his office and proclaimed, "Hey doc, the reason I'm here today, the reason for my visit is I feel wonderful"? Well, you know what would happen? He or she would probably chuckle and laugh, just like you're doing right now. Maybe you would get your heart and lungs listened to and have your blood pressure checked. Then what would your doctor say? Your doctor would probably say to you, "Hey, I'll see you next time you need me." What does that mean, next time you need me? That means the next time you are sick. Well, studies show if you follow that approach, that is exactly what you are going to be, sick. And your health care that focuses on treating you when you are sick, well, you only get what you focus on. If you focus on sickness, illness, and disease, then you get sickness, illness, and disease. However, if you focus on health, such as enhancing the vital energy of your body using acupuncture, making sure that the brain can communicate to the cells of your body, optimizing the nervous system function and the ability for the nervous system to transmit that vital energy in the form of nerve impulses by identifying and correcting subluxations and making sure that the physiology of your body is at its peak through analysis and development of specific nutritional programs, then what do you get? You get the best health you can have. You get expression of your best self. You get health and vitality and energy and joy. You say, prove it? Here are just some studies. a Dr. Henry Windsor did autopsies to determine if there is any connection between minor distortions of vertebra and diseased organs. What he discovered was that 96% of the nerves that supplied diseased organs came from damaged vertebral levels. He indicated that there was nearly 100% correlation between minor curvatures of the spine and disease of the organ. Here is another great study that really brings home the need for holistic healthcare as a means of staying healthy. Tapio Wiedemann, MD, proved that a subluxation that remains for more than 10 days, the joint begins to degenerate. What he did was he took a rabbit and subluxated their knee joint, and after 3 days of subluxating that knee joint and affecting its normal movement, what happens is similar like what happens in your spine when your vertebrae are out of motion, subluxated. He found that scar tissue starts forming after 7 days. Wow. But after 14 days, 2 weeks, he found there were the first signs of eburnation of the bone. That is exposure and wearing and hardening of the bone because of breakdown of the protective layers in the joint. If you've had an x-ray, this might sound familiar. If you have lived too long with a subluxation, he found 3 things happen. The joint space gets smaller, spurs start to develop and form, and calcium started to form inside the joint as well. These 3 things combine: joint space getting smaller, spurring, calcium formation. What are those called? It's called arthritis. So by keeping the joint in motion, by keeping the spine adjusted weekly, preventively, we avoid the breakdown of the joint. So in addition to restoring communication between the brain and the body, the second reason for an adjustment that I do as a holistic physician is to help avoid arthritis. He discovered that you could see arthritis after 2 weeks. And if that was happening, that it had to start microscopically within literally a few minutes. So we do not want to allow subluxations to exist because eventually symptoms will show up, and we want to adjust that joint and correct the imbalances before there's a problem. You know anyone who's anxious, who has high blood pressure, maybe high cholesterol? Is the best approach medication? Well, a Dr. Seaman discovered that a lack of movement of spinal joints, what is that again? A subluxation, creates a fight and flight response in the body. And here's what happens. Your blood pressure goes up, your heart rate goes up, you develop blood clotting factors, blood fats like cholesterol and LDLs and insulin and glucose all go up. Your cell-mediated immune system, though, goes down. He indicated this reaction can actually lead to cancer, colds, influenza, and other infections. He found that your body decreases serotonin, which downregulates learning and upregulates anxiety, fear centers in the brain. So this happens so you can react to stressors more effectively. However, this leads to increased anxiety, fear, depression, and learning attention deficits. So a solution to these problems is to improve upon the vital energy with acupuncture, correct the subluxation with adjustments, and correct physiology. Doesn't that make sense compared to providing a medication to suppress what you are experiencing? How about overall health? This is awesome. From the 2004 Journal of Manipulative and Physiological Therapeutics, studies show that people who received just part of what I do, just chiropractic, and they did it for once a week, what they called in this study maintenance, people who did that for 5 years get this, it is remarkable. They experienced 62% fewer hospital admissions. That's amazing, 59% less days hospitalized, 62% less outpatient surgeries, 85% less pharmaceutical costs. Now imagine if they added acupuncture, diet, and nutritional interventions like we do at the Pain and Wellness Center. If you want to be healthy, just doing acupuncture or chiropractic or nutrition alone will not do it. Yes, each of these interventions can help, but if you want the greatest chance of living healthy, you need a holistic approach. And who do you think should be under holistic health care? Well, your entire family. Everyone should be checked for subluxations. Everyone should have the highest level of vital energy maintained with acupuncture. Everyone should have proper diet and nutrition for optimizing their physiology. My son and daughter were adjusted right after they were born. Remember what I told you earlier, and recall how I explained how gentle the adjustments that I perform are. Our mission at our office is to provide a holistic approach for pain management and better health, to restore and maintain the health of our community, beginning with you, your family, and friends. Once you see the results you receive from this type of health care, you will want to tell your friends and family. You will want them to be able to restore and maintain their health as well. You are now part of an informed minority. I want you to go tell the uninformed minority. That's the end of our orientation. Now, go on and follow the holistic approaches that I've talked about.